and welcome to our webinar organized by Globesight on leadership and pandemics, the role of the United Nations during the COVID-19 crisis. Good afternoon to those dialing from Europe, Africa, and the Middle East, and good morning to those joining from the US. We have a very interesting discussion ahead of us today and a great panel that I will introduce shortly. My name is Miriam Duta. I am part of the advisory team at Globesight, and I also lead the US office. We'll be moderating the discussion today. Globesight is a global development firm with hubs in the UAE, Turkey, Pakistan, and New York. And we also have a growing presence across the Middle East, South Asia, and West Africa. Our scope of work is across the SDG agenda, with a particular focus on global health, the humanitarian and development sectors, as well as gender equality. We work with a wide range of leading organizations and multilateral institutions on how to address some of the world's most pressing socioeconomic issues, and we also advise them on strategy and on establishing innovative partnerships. We also work on research and knowledge and advocacy. Since March, Globesight has been organizing a series of COVID-19 related webinars, and so today's webinar is really intended to provide insights on the role of the UN, leadership in response to COVID-19, and it is also a reflection on how effective the UN is in providing leadership during times of global crisis as it celebrates for its 75th anniversary. Joining me today, we have three very interesting panel members. Tawfiq Rahim, who is the founder and executive director of Globesight. Through Globesight, Tawfiq has led high-level strategy projects with many of the leading global multilateral and philanthropic organizations. He is also the co-founder of YVRDXB, which connects the economic hubs of Vancouver and Dubai. He is also a senior fellow at New America. He has also served as a fellow at the Dubai School of Government, as an expert advisor at the United Nations Alliance of Civilization, and he also sat on the steering group for project on cultural dialogue and international security at Chatham House. Previously, he worked with McKinsey & Company, the Aga Khan Foundation, as well as the United Nations. We also have with us today Vivian van de Perre. Vivian has 25 years of experience with the UN, and she is currently the Director of Field Operation Finance Division in the Department of Management, Strategy, Policy and Compliance in UN headquarters. She has also served as Chief of Staff of the United Nations Stabilization Mission in the Central African Republic, Chief of Staff for the UN Stabilization Mission in the Democratic Republic of Congo, Head of Office for the Special Envoy Office in Burundi, and Executive Officer for the Department of Political Affairs. Before joining the UN, she was a career army officer in the Netherlands and retired with the rank of captain. And we also welcome David Gressly, who has 40 years of experience working primarily in Africa in the fields of peacekeeping, humanitarian assistance, and development. Since 2015, he has been the Deputy Special Representative of the Secretary General, DSASG, for protection and operation for the United Peacekeeping Mission in the DRC. In 2019, at the peak of the large-scale Ebola crisis, Mr. Gressly stepped away from his current role to lead the coordination of international assistance for eradicating the epidemic in Eastern DRC. Prior to that, he served at DSASG, resident coordinator and humanitarian coordinator in the peacekeeping mission in Mali. He was also the regional humanitarian coordinator for the Sahel region in 2012 food crisis. And prior to that, he served as regional coordinator in the UN mission in Sudan, where he led the UN support in South Sudan to the census, the election, and the referendum for independence. We are very excited to have all three of you here today, and we are just going to move to the agenda. So I'm first going to give 5 minutes to each panel member to set the stage and share their perspective on the current situation. After that, we'll have some targeted questions for about 20 minutes, and we'll then take up questions from the audience. So let's get started with Taufik. And Taufik, if you could share your perspective on what has happened on the global stage, and has the world come together in its response to COVID-19, and whether there is one multilateral approach and who is leading it?
Thank you, Mariam. Great to be here alongside David and Vivian. I'm excited for the discussion we're going to have today. I think we'll try and be purposely provocative and critically constructive. Let me get right into it, because I think, Mariam, you posed a good question around global leadership and where are the multilateral forces coming in. I think, at the beginning of the year, as we were entering 2020, we thought we were entering actually on the back of a global crisis, which was the conflagration with Iran. I mean, if we go back, which seems like a lifetime ago, that is what we were confronting at a global stage. And there was an alarming take, because it really felt that we could have a severe deterioration in the kind of global geopolitical situation. And when that eased, we moved right into kind of the status quo of all the issues that were being dealt with, on all sides of the equation. When the pandemic approached, it came in kind of a slow and steady pace. It started in China. It was something where the World Health Organization took some time to declare as an international global health emergency. Took some time until I think around March 9th to declare it officially as a pandemic. And it was when it took kind of root in Europe, I think the seriousness of the world started to pay attention. But in a strange way, the centers of power in Europe and in New York for the United Nations were actually the most acutely affected in, let's say, those early days right after the initial rise in China. And so instead of having this mobilization from some of our key institutions, they themselves were frozen, not just at an institutional level, but at a very individual and personal level. People didn't know where they could go to work. They were themselves in lockdown. And what we saw was the UN Security Council unable to convene, and if it was having any type of discussion, unable to kind of lead to decision making. When we eventually had the multilateral system respond, the European Commission, along with the G20 under the auspices of Saudi Arabia, were the first to put forward some type of multilateral leadership that would complement the efforts that the World Health Organization were coordinating. What was happening behind the scenes is that certain philanthropic players, as well as international organizations, were trying to bring this into some type of umbrella, which ultimately became the ACT Accelerator. That the European Commission hosted a couple of pledging sessions around, the latest in partnership with the Global Citizen at the end of last month. But until this point, other than the ceasefire resolution, there hasn't really been a UN Security Council resolution on what I think is the most unprecedented global crisis of this century, and we'll see what it means over the last 75 years. The point that I want to just impart as we enter into the discussion is that we are at a truly seminal moment. And it seems like a moment like 75 years ago, but we don't have a true convulsion that is reorienting the global architecture. And my largest worry is that we aren't seeing a mobilization that's creating a global response. If we ever think in a scenario from a Hollywood movie, when you have an alien force coming here, we're all going to band together as humanity and confront this together. And if you look at the vaccine efforts today, and you can go to the Milken Institute, they're tracking it, there are about 200 vaccine efforts in earnest that are going on in the world right now. 25, let's say, leading cases. It's not one big common effort that's coming in. It's extremely fragmented. And as we are on the precipice of what could be potentially, I mean, I don't need to be hyperbolic, a Cold War between two geopolitical forces, the question is this pandemic leading to an opportunity for cooperation, collaboration, and the antecedents to what could come of really an effective multilateral architecture, or is it demonstrating that we are a long ways off? And so, with that framing, Miriam, I'll give it back to you, and love to hear the thoughts from David and Vivian going forward.
Thank you, Taufik. Vivian, would you like to walk us through the challenges facing the UN when responding to a global pandemic such as COVID-19?
Thank you very much, Miriam, and thank you for the invitation. And it's good to see people and colleagues here online. So I would like to address this at two levels. One is at the headquarters level and one is at the field level. I happen to have moved from Bangui to New York at the beginning of June. So I have seen both sides. And to start with headquarters level, there's some practical challenges that we all face. So we all have to work remotely. This proved to be particularly challenging in what's called the Fifth Committee in June, the budget consideration, because we had to change the procedures. As we could not have any voting in the room, we had to try to go to e-voting, and that was resisted by some member states. So a whole new set of procedures needed to be put in place, which led us to have to conclude the budget consideration basically 2 weeks before normal years. That sounds like a great thing, and it was, but it was not easy to do that. To prevent that on 1 July, there would be no more money for peacekeeping. That would have been quite dramatic. So, of course, member states had many questions about how COVID impacts the work of the UN, and particularly how it impacts the resources. And I must say, it's quite too early yet to say what the overall impact will be. There's some places we spend slower, some places we spend faster, and we don't quite know yet how it will play out. And we're required to report back to member states on this in the next round. But I would like to highlight the most important impact of the crisis on the UN as a whole is really an existential threat. We're having a liquidity crisis in the UN. We always balance the cash inflow very precariously in good years over the last couple of years. But this year it has really exacerbated. Countries are so stretched back home in their COVID response and the resources that they need that they can't find the money to pay their UN dues. And we've seen a significant slowdown of incoming cash. And it has led us to need to put measures in place for the regular budget, not allowing entities to spend their entire budget that was approved simply because there's no cash. And we're heading slowly in the same way for peacekeeping, which is a different scale of assessment. So this can really have a huge impact if member states cannot find the money to pay for the budgets that they have approved. And we can talk about that more later. I won't go into details. I would like to quickly talk about the challenges at the field level. As you know, I came from MONUSCO, and I would like to just share some perspectives, particularly for people that are not in the field, to give an insight on how difficult this is. There are countries who can manage their COVID crisis themselves with strong governments with resources, and they are struggling. Then there are countries on the other side of the scale that on a good day, they can't manage their own country and they don't have the resources. Now imagine they have to cope with COVID on top of that. They simply can't. So some of those countries that are very fragile, the UN has peacekeeping operations or special political missions. So everybody looks at the UN to step in and help. So that's the reality on the ground. That had some side effects that some of our field missions were actually ahead of the policy being developed at UN headquarters in terms of reacting to COVID and putting measures in place in the country, because there was simply no choice. We were the only game in town. At the same time, it was a challenge because when the international flights suddenly just stopped, and it was as drastic as that. We had 4 airlines coming regularly to Bangui. They just stopped. So the consequence was that some people were more or less permanently stuck outside of the mission area. Some were more or less stuck inside the mission area. So that created a lot of tension for the people that could basically not leave anymore, and that also had their families back home to worry about. or medical needs, which are very limited in a country such as the Central African Republic. On top of that, of course, the population was kind of looking at the UN, knowing that we fly a lot and we are very mobile, and thinking, well, those are the people that are going to rise the virus. So you have stigmatization going on, and you could really notice it in the streets. So for people to move around, the UN staff to move around in their big white vehicles very visibly, that's created reactions from the population that we had to deal with, and which really put, in some cases, the safety and security of staff in jeopardy. So that made it even more difficult. So in order to deal with that, I told you international flights stopped very quickly, and they're still limited in some continents. But we also suspended our internal flights so that we wouldn't inadvertently be spreading this virus in this country that has basically very little medical facilities. So we didn't want to be the cause of the spread of the virus. The side effect of that is that staff was literally stuck in the deep field, living in containers for months and months and months at a time with no relief in sight. So that is really very difficult for the staff. In general, in a country like CAR, social distancing is not very realistic, and hands washing is not very realistic either because of the lack of water. So the UN really partnered with the government, as well as with the country team, and as well as with willing and able NGOs to come to a coordinated and integrated response to provide some of the basic necessities for the population, which you wouldn't have to worry about in countries where we have headquarters locations and offices away from headquarters, because the governments there will be able to deal with that. But in countries with missions, with field missions, it was really the UN that had to pull that all together. Despite all that, we never stopped implementing the mandate. It was very clear that we had to just keep implementing the mandate. And the mandate is to progress on the peace talks and to provide protection of civilians. And the SG call in that regard for a global ceasefire did help for a little bit until everybody moved on and went back to fight as they always did. So I addressed the weakness of the state. And I would like to add one thing. We were very reliant on medical evacuation to other countries because there are not really adequate health facilities in countries like CAR. And that stopped because other countries did not want to receive our COVID patients. So all of that put a lot of stress on the staff that were there trying to implement the mandate under difficult conditions and not being able to leave, and under a climate of stigmatization. I'll leave it at that, and we can go into more detail later.
Thank you, Vivian. And we'll go back to a bunch of your points because you raised in some very interesting points there. I'm going to turn over to David. David, based on your long experience in the UN, can you shed light on how the UN has dealt with pandemics in the past, and what are the lessons learned that can be applied to the COVID-19 case?
Well, thank you very much. I thought maybe what I would talk about in this session is the work that I have done. First of all, I want to say I'm not a scientist. I'm not a doctor. I studied economics. I have an MBA in international finance, which makes me eminently capable to deal with pandemics, epidemics, and so forth. But basically, I worked in UNICEF many years ago in India. And I'd like to start there because that was for polio eradication. Not an epidemic, but it has some very important things that I think flow forward in time. And two key issues. I was responsible for the polio portfolio in UNICEF, and we worked together with WHO on this. We had two primary things that we had to focus on in UNICEF. One was the actual supply of vaccine for eradicating polio, basically. And India presented certain challenges simply because of the magnitude. I needed to raise $20 to $45 million every 6 to 8 weeks to keep the flow of vaccine going, because we had to do vaccine campaigns that frequently. Secondly, we purchased 1 billion doses a year of vaccine, 50% plus of the world's supply. First time I studied economics, I never thought I would use the word monopsony, which means one buyer. in a market, which is the opposite of a monopoly. That was us. And so we had to work with suppliers to make sure we had actual supply chain of vaccine coming in. There was an 18-month lead time. I had to get the money. I had to make sure there was the pharmaceutical companies. We actually worked to develop those companies inside India. So that was one piece, financial logistics. The other piece was social marketing, basically. At that point in time, the number of cases had been reduced from 350,000 down to not so many, don't remember the total, but concentrated in 2 states, Uttar Pradesh and Bihar states. And there the problem was resistance from participating in the campaigns from very marginalized communities in those 2 states. So we had to really work on strategies to engage with these communities. And that's something that flows through all of the examples I'll give in a moment. Often the basic problem is you've never come here before to offer us anything in terms of services. Why now? And so you had to do key leader engagement. You had to work with communities to explain why it was important, and also introduce services that they hadn't been receiving to create credibility. So that was a very interesting introduction to this kind of business. I've worked in 4 Ebola outbreaks up until now, and hopefully the 4 is enough for me. The first was in Mali, and the thing that I learned there, that was a part of the broader West African outbreak. We had a couple of cases that came into Mali that needed to be contained. But even with those few cases, I learned, I think, 5 main things that I would cite with that disease. Unlike polio, where nobody really feared getting sick with polio that was working on it, Ebola is frightening, and it created fear. It created fear with those who were working on it, but just fear in general by our office, people working for us, etc., in the communities themselves. So managing fear in that kind of thing was extremely important. I had people calling me saying they were going to die because they were a contact. I had to send gendarmes to go protect the hospital where we had soldiers who had been wounded in the north with IEDs that happened to be in a hospital that had an Ebola outbreak because there was a threat to burn down the hospital. Managing fear is extremely important in that kind of context. And then we came up with 4 overall, and it's very similar to Vivian, so I won't spend time on it. 1, we wanted to work not to be a vector because we didn't want to be stigmatized ourselves. 2, we wanted to protect our staff from them being infected, just so we can maintain operations. We were very afraid that a lot of things would shut down if we were known to be infected with Ebola. The next thing was to support the government with a fast response, logistics, working on the issue of resistance, which was there again, the issue of finance, etc. So all of the things in polio folded forward plus. And then finally, as Vivian said, methodologies to keep operations going full tilt. And we were having a very active conflict in the north of Mali at that point in time. And then coming to the Congo, I thought it was away from Ebola. We had 2 fast Ebola outbreaks, one in an isolated area, demonstrating the need to get logistics there. That was the main thing that made the difference there fast. The other was in the east. It was much more of an urban outbreak, which they'd never really had too many here before, creating its own dynamic. Easier transmission, actually greater resistance coming with that, challenging logistics there as well. And then we had the outbreak in North Kivu. And the difference there is that was in a complex emergency. It was a conflict area, and it got out of control. And I think here's a key set of issues that came out of that. In the attempt to try to eradicate this in a complex emergency, sort of a sledgehammer approach was taken. We're going to do this whatever it takes. Pour in the money, pour in the people, et cetera, et cetera, et cetera, without taking into account the consequences. Consequences such as suspending vaccination for measles. I spent too many times going to hospitals where Ebola patients were being, potential suspect cases, I should say, turning out to be children that had measles, that were dying of measles because they had not been vaccinated. And they weren't vaccinated because they were creating the space to run the Ebola response. So the unintended consequences also have to be managed when it becomes a larger dynamic. The money came in, altered everything. There was an Ebola business mentality that came in that compromised the response, actually increased the insecurity. So unintended consequences, I think, was the big lesson coming out of Ebola. And when we finished with Ebola, finally, it was like a big relief. I was thinking back on all those others, from polio up to Ebola 4 for me. I'm going, wow, this is like a video game. We had level 1 in India, level 2 in Mali, level 4, 5 in Eastern DRC. It's like the emperor level. All right, we did it. And then the deity level hit us with the pandemic that came in just as we finished the Ebola one. And that has its own set of consequences that we had to deal with: the economic shutdown, the human lockdown, the transportation lockdown. In fact, I was looking around in mid-March, I'm going, whoa, this is like a global game of musical chairs. Everybody needs to choose the chair they want to sit in because the music's about to stop and better get there in a hurry. And that's exactly what happened. This includes my own family, children and so forth. So when there's nowhere to go, limited resources, you end up having to manage on your own. You have to figure it out yourself. And that's really what we did. And I'll just conclude here because I probably used more than my 5 minutes, and Miriam will jump in if I'm not careful. But basically, this pandemic, I think, requires us to learn from all of these lessons I've described. Fast response, the financial flows that are required, the various points of management that I described from Mali. How do you overcome fear? How do you overcome resistance? How do you do this in urban environments? Corona is very pervasive in urban environments, as we know, for the same reasons I described for the other diseases. And finally, how do you target interventions to check Corona by minimizing the unintended consequences of those interventions? I think that's a central challenge as we go forward. Thank you very much.
Thank you, David. Very interesting. I'm going to have a follow-up question on what you just explained. So heading to the likely next phase and second stride, how do you think the UN is ready to apply the lessons learned from the current phase?
Well, I'll be short on this. I think what's key is to continue to adapt as this thing goes along. And I think we're finding strategies locally each time we run into an issue. One of the big issues here is that COVID is an elite disease in many ways. It's affecting the elite more than the average person in the population. So we've seen the senior officers in the military, senior people in the civil service supporting the government die because of COVID, even though we've only had 200 cases. It's the deaths, I mean, it's been disproportionate, that impact. So it's managing these unexpected changes that come, that I think is also going to be very important. But it's more the operational dynamics, maintaining that as the disease spreads, how we continue to operate safely, and testing will be a key part of that. Testing is important for all of these things that I described. Active and rapid testing allows you to manage things much more effectively. If somebody gets infected, you know about it, you know who their contacts are, you can determine whether they have been infected or not. It gives you a chance to control things. And like Vivian said, isolating different parts of the operation is extremely important. It's like you can protect everything else if there is a problem in location A, simply because you're not moving back and forth. Extremely important that we maintain that kind of separation in terms of operations, so that one doesn't stop everything and we can manage just the one. And we're doing that with our troop rotations. We're recommending that troops that come in, and we're rotating them, don't quarantine them all, one battalion together. Quarantine them in company size or even less. So if one person's infected, we don't lose the whole battalion. We only lose one unit. And we can replace one unit easier than replacing the whole battalion. So that you can replicate on multiple levels, on the police side, the civilian side, etc. But maybe I think I've talked too much. So over to you.
Very good. Very good. So before we continue to the next questions, I would like to ask the audience to start typing their questions in the Q&A tab, so we can ask some of your questions later. But now I would like to elevate the discussion to a more global level and ask you, to what extent can the UN encourage more cooperation or greater cooperation between some of the larger powers? So I'll turn over to David, and then I'd be happy to hear from Vivian and Taufik on this.
Okay, well, you know, I think I'm going to just give a general answer because I don't really do that kind of work. But you know, being credible is the most important thing in any of these kinds of interventions. So credible in terms of your advice, credible in terms of the actions that you've taken, so that people believe what you're recommending is the way to go. So be careful to be that, because sometimes people take your advice. That's applicable in many situations, not just in epidemics. I feel the same way in our advice we give to governments. Make sure it's good advice, because they might actually do it. So it's important that we do the same here and remain credible, thoughtful, think through, not just superficial, think through where are the interventions that will make a difference, not just generalized statements. And it's got to be ground-based, based on ground reality. What has actually worked, what is the problem, etc. So, you know, I could go into specific details, but it's that I think that sometimes is missing. And we need to find ways to get the politics out of this and focus on facts. And facts are what will lead us, I think, to success. Over.
Thank you, David. Vivian, any thought on that question?
Yes, the fact that David mentioned facts triggered to me, this is really an unfortunate time for this pandemic to come along, because we don't seem to agree on facts anymore the way I was used to from a decade ago. Governments have approached this in such a different way around the world that it's really become very challenging for the UN to pull it all together, because of course they are our bosses, not the other way around. But as David said, if we give advice, it needs to be good advice. But it's really, in this day and age, it's really more challenging to get the member states on one page. So nevertheless, we keep trying that. And I hope that Tawfiq has a little bit more practical advice to give on this, because I really don't. Thank you.
It's super interesting hearing, I think, from both you and David, and you know, on the situation in the Central African Republic now, and going back to, you know, polio eradication, a few geographies, and of course Ebola at those different levels that you mentioned. There are so many moving pieces, right? I mean, just you talking about the troop movements and how that can become a vector. I think that's the complexity in which particularly fragile states, we just actually take for granted that somebody's taking care of it. And more often than not, it is the UN, especially when you have, I think, to be honest, David, someone with your leadership, but also others on the ground, making sure these important lessons that have been learned in the past are applied. And so there are a lot of, you know, I think cases, I mean, we're looking at, you know, I think you look at Yemen about a couple of months ago, was really at a very difficult place. So there are those vectors, I think, at those levels. But then when you zoom back out, I think, Miriam, to your question, you know, how do you get some of these great powers to kind of convene around the table? I think this is the tough task that's at the feet of Antonio Guterres and at the feet of others. And I think it's very unfair in one sense, because these are forces and interests that are beyond the scope of any, I think, one leader or agency head, in the case of Dr. Tedros, to bring these people together. But actually, I think the point of credibility, which is one, David, you mentioned, is key. I think there is, you know, from end to end, from top to bottom, the UN as an institution, I think, has the most credibility with its reach, with its varying technical expertise, with its experience to play this role. It's not going to happen in another forum. What we've seen is, if it's in the G20, you're getting a set. If you're in the G7, you're getting a set of countries. If the European Commission, they're convening. And what I've seen, at least from our vantage point at Globesight, because we're in a few different geographies in the global East and South, you're seeing regional groups come together. You're seeing bilateral conversations. But quite frankly, we don't have that pace. And I think coming into September, there's a true moment. And I think if you go back to the mid to late 90s, you go back to Kofi Annan's tenure, right? And probably where you know, and then in the early 2000s, from the Rwandan genocide to the Iraq war, these are very difficult circumstances where I think it's very difficult for the UN at that level to play a role. But there are moments that come and go. And I think September is one of those moments, September, October. We're going from year one to year two of this pandemic. We don't know what's gonna unfold, both from the fact that the cases are going up in sub-Saharan Africa and other geographies now, to what is the next real wave of the virus in places that it's already hit. Is there going to be any type of differentiation? And I think it's incumbent on, whether it's at the secretariat level, whether it's with the incoming president of the General Assembly, Turkey plays an interesting role, the Turkish representative, somebody's going to need to step up to convene and challenge. We haven't heard the challenge laid down. I haven't heard any single country head, government figure, or international figure really say earnestly, China and the United States, you need to get in a room and figure this out. You may have 2 decades of issues coming up on trade, on the economy, on the Southeast China Seas. Maybe that's going to still unfold. But for this pandemic, for 1 year, we need to get it together. If we have research, we need to pool our resources. It's not happening. I'm waiting to see who that figure is, but it needs to happen. The only place it can happen from is the UN. And we'll see if it does, Mariam, but that's what we're looking for. And it's easier said than done. I know all the things that are at play. I know all the interests. I know that people are earnest in what they're doing. I think all of us know people who are working in that orbit. I don't think we would say any of them, whether the advisors or others, are not trying their best. But that's the moment we're in. And we have to see what happens.
Thanks, Taufik. Building on that, I mean, DSG has been very strong from the beginning of the crisis on the humanitarian ceasefire. And finally, the Security Council adopted the resolution on July 1st, the resolution 2532. And I'm curious to know how this has impacted your work on the ground. Have you seen any positive outcome before and after the resolution? Over to you, Vivian. And then I'd love to hear from David as well.
Thank you very much, Miriam. It's always difficult to say why armed groups take a pause in the hostilities, whether it's related to the fact that 1.5 years ago, a peace agreement was signed and everybody took a wait and see approach to see what would happen next, and it was the tail end of that. Or was it that they were scared of COVID? Or was it that they heeded the Secretary General's advice to, with the interests of the population in mind, to just scale it down for the time being, well, hopefully forever, but to stop focusing on fighting and preying off the population, which they normally do, right? So it's hard to say, but we did have a little bit of a lull there. And I think it's all these factors coming together that made armed groups more susceptible to trying to cooperate at least a little bit. But I think a big part of it was the peace agreement. But I just want to say also that it became, in a way, a challenge for us to talk to these armed groups and to continue mediation with them and negotiations with them, until we figured out that they were amenable to come to the UN offices out of the bush and sit around a VTC screen and have VTC conferences with us, which is something that they had never done before. But because COVID sort of necessitated that, we did it. And the advantage of that was we were able to bring in people from the government to sit in those VTCs. Everybody is separated by thousands of miles, so there's no risk of it erupting in fighting. And then they would talk to each other for the first time face to face, because normally the government couldn't fly to the rebel held areas because they would fear for their life. So it had some consequences, some unintended consequences, which were very beneficial for us. So I like to think that we moved some of the armed groups forward, taking advantage of a good crisis. Other armed groups, of course, did not cooperate. They're all different, and we have another armed group, the 3R in the West, that became even more brutal and worse. But traditionally our biggest opponent, called the FPRC, they actually calmed down a little bit. So that's the experience we had in CAR. But I'm sure it's different in every country. But my point would be, never lose a good crisis to take advantage of.
Very interesting. David, any thought on this?
You know, we're in a country where we can't even count the number of groups. There's probably over 100. It changes frequently. So there would have to be 100 different explanations to really to say. But what I would say in general, I think generally, while it's a bit calmer now than it was, say, 2-3 months ago, it's other factors that are contributing to that. The main problem really was the inability to move people around to support dialogue, getting the right government personnel on the ground. But we slowly overcome those so that we have demobilization continuing. We do it differently because of COVID. We're getting more freedom of movement to support dialogue on the ground, and that's having a positive impact. So that the real issue has been overcoming the restrictions that we had basically imposed because of the COVID pandemic. And what I mentioned before, some of the disruption by those who, through the deaths because of COVID. But, you know, we're overcoming. In fact, we had one general I just learned died of COVID. A senior commander here in the East died, I just learned in the middle of this broadcast. So it's very real. But nonetheless, there's a will to move ahead. There's an underlying desire by both the government centrally and groups on the ground. There's a real fatigue here. It's been going on for a long time. So we can take advantage of that fatigue as a way to try to find ways to get people together and overcome the distrust that's quite deep. And that moves ahead. Over.
Thank you. I'm turning to the audience now. We are going to take some questions from the audience. I'm getting one from a colleague actually an ex-colleague in Mali. So I'm going to ask David this question, since I think you know that context the best. So the question is, what about the COVID exacerbating an already existing multidimensional crisis in a fragile environment as Mali? And how do we, and how do we adapt to competing interests?
Well, I mean, that's similar to the situation that we have here anyway, and what Vivian faced in CER, I'm pretty sure. I think I kind of explained a little bit before what we've done to overcome what COVID is exacerbating. Once again, it's not at the same level of intensity of transmission as in other parts of the world. We're still below 10,000 cases and about 200 deaths. It's where the deaths have happened that have been a problem, and it's been the impact on movement that's been particularly problematic. So we continue to find ways to overcome that. Some of the methodologies that Vivian mentioned, the using VTCs and social distancing. We have policies for all of that. And we have been very clear since the beginning that we want to continue to deliver on our mandate, continue to be with the population, but be protected and protect us from transmitting it. And so far that's been pretty successful and not to the point where we've had to really stop anything fundamental. And I think, as I said, and I'll just conclude on this, we're just going to have to continue to adapt. As long as the desire to act is there, and you use your thinking to figure out how you can overcome this or that constraint, there are solutions out there. We haven't found anything fundamentally that has stopped us from going forward. Over.
Thank you, David. Building on this, Vivian, do you want to give us an idea of how COVID has also created new opportunities for the UN on the ground and in headquarters?
In headquarters, it's the obvious. We have proven that we can all work remotely. So assuming that this virus is going to be around, vaccination or not, I think we need to really think about how we work in the future to avoid putting like as many people as you can in one big building and freely sharing all your viruses, whatever virus that may be, or bacteria or whatever. So I think it is an opportunity to rethink the way we work. In terms of on the ground, I think the lessons learned are even greater. I really think we always talk about integrated missions, and we're doing a good job. But this crisis really brought it home that alone we can't do anything. None of us can do anything. The handful of people in WHO, the handful of people in FAO. Nobody can accomplish anything on their own. We need to do it together, and we need to do it together with the government and the country team and all the resources that peacekeeping has, and pull in the NGOs. Let's not forget them. They will need us, the UN, for evacuation if there's unrest, etc. So they are very aware of that. So they're more than willing to come and help us before we get to that point. So for me, it's been a positive experience with all the negativity. It's been a positive experience that we really made great strides in actual integration. And I think that once you work that way, it will just last. It will have a long-lasting effect. And that's where we need to get at. Instead of working in silos, we all need to work together. So that would be my thoughts. Thank you.
Thank you, Vivian. I'm getting another question from the audience here. How will the UN system cope with the legitimacy challenges coming from big donors like the US? I'm going to turn over to David and maybe Taufik as well.
Well, I think it goes back to what I said before. I think we've always seen from member states, if you can, at least in my experience, if you deliver, then that's where your legitimacy comes from. And I think we're doing that. And I think it's respected, certainly here in the Congo, and I suspect in Vivian's case, it was the same thing in the CER. There's much appreciation for the work that the UN has been doing. So I think it comes from delivery at the end of the day. So, you know, I'm not going to get into the larger issues because I'm not a part of that, but I can just share with you what I've seen on the ground. And I'm talking about member states in general. There's a real appreciation with that. I mean, you know, this remote working actually has been very useful in some ways because it's actually shortened the distance between Goma, where I work, and Kinshasa, with different partners, including the different member states. I'm in regular contact with them via Microsoft Teams or Zoom or whatever, in a way I was not before. So we're learning things that I think will be useful in the long run. And that frequent interaction with member states is extremely important so that they understand what we're trying to do. And this is in general, not just COVID, what we're trying to do, how we analyze it, what challenges we face. And if we're honest with those challenges, that we don't quite have the answer for this or we need support for that, it's usually well respected from what I've seen in almost every circumstance that I've been in. Over.
Great, thank you, David. I'm going to turn over to Taufik. Maybe you can build on Vivian's hope and David's insights as well, and give us a more global perspective on opportunities for the UN moving forward.
What was the last question in particular? It was
how will the UN system cope with legitimacy challenges coming from big donors like the US?
Yeah, I mean, it's a difficult question, right? Because the UN is, you know, as people I think within the UN would attest to, is not just one body, right? It's actually so many bodies across so many different countries. So we have the agencies, we have the political bodies, we have how the country kind of missions are, where there are peacekeeping operations, it's a little bit different. And so I think it does depend firstly on that country to country level. I think, you know, what are the donors in those country missions? And I think that affects on an agency level. When you look at WHO and you look at the amount that the United States contributes to the agency, it's a big aspect there. And so, you know, we work obviously a lot around global partnerships, and I think it's very important if you are a UN agency to be diversifying how you think of your stakeholders. You know, I remember we were doing a global partnership strategy for a UN agency, I won't name it, and at that point they were getting 40% of their resources from the United States. And we went to see the State Department. This is like 5 years ago. And they literally showed us their internal metrics. And sometimes in the Congress, you have not a particular UN agency, line item. You have an overall line item around an area, whether it's migration, et cetera. And then from within there, the State Department can program, right? And so, but they have guidelines which are limited to around a 25 to 30% cap. And so if you're at 40%, you're over. Now that cap is based on really the share of the US in the global economy, which is, growing smaller over time. But a lot of UN agencies have not adapted. They're still stuck in that kind of modality. And I think as this situation unfolds over the next 1-2 years overall, in the way the global landscape is changing, you have to have a diversity of stakeholders if you're going to be able to have any independence or autonomy as a UN agency. They're in trouble right now because it's very hard to have autonomy. And actually, what's happened because of the nature of each organization, they have recurring payments that need to go out each month. That what is the notional additional and supplemental funding that has been coming to UN agencies has become core and essential. They can't survive without that supplemental. So which means that not only is it 25% existential, but actually the 1% becomes existential. And so it becomes very hard to autonomously navigate. That's at the agency level. I think at the mission level, it might be different, in how that's going. But I see you have a couple of other questions, Miriam, in the Q&A, so I'll give it back to you there. In the Q&A, yeah.
Sorry, trying to find the question. Yeah, we have a question on how the situation with the WHO will have an impact on peace operations. Maybe over to David.
I just let me be sure that I've got the right question. In terms of the dynamics between UN agencies and its coordination between agencies happening on the ground, is that the question?
That's one part of the question. And in terms of the dynamic between the US and the WHO, is this having any impact on you on the ground? On peacekeeping operations?
In terms of a peacekeeping mission, I'd have to say probably not, but in terms of our operations, because it's not really a significant factor. So I won't touch on that, but I will say we've been working very closely among the UN agencies here in Kinshasa and Goma, because Goma is a major regional hub for the UN inside the country. And we've been actually doing more now. I have to say the lockdown has been useful in one way because nobody's traveling, nobody's visiting, everybody's here all the time. We're actually working through a number of issues at the strategic level and operational level, pulling on board not only the whole of the mission, but we're bringing in the humanitarian agencies and development agencies with the UN and in our NGO, international NGO colleagues as well. So it's been very useful actually to have this opportunity. It's almost like a pause that allows us to do a deep reflection on how we want to go forward in terms of peace operations, in terms of support to the humanitarian community, the transition of the mission, all of these things. We've really made a lot of progress in the last 4 or 5 months, and it's really pulled the teams closer together. And it's not even talking about responding to COVID. It's just the broader benefit that we have through the kind of work we're doing remotely together now that wasn't there prior to COVID. So there's a lot to work with going forward. So I'm very optimistic. And there's a lot of enthusiasm by the different agencies on how we can continue to improve this kind of cooperation and coordination, the national level, provincial level, et cetera. So I'm very positive, actually. Over.
Very good. And then one last question from the panel, and I'm going to turn to Vivian on this. If one or more of the vaccine trials are successful, what do you think needs to be done to ensure that the vaccines get quickly to those who need it in conflict affected states?
Yes, thank you, Miriam. That would be essential. The question is not to get it there, which will be a challenge. The question is, will they accept it? You know, the misinformation that is circulating around the world It is no different in the middle of Africa. It is maybe even worse. So people are skeptical of vaccines, so it will need a very convincing, very targeted, very large information campaign. And probably the UN would have to take a lead into setting the good example by taking the vaccines ourselves first, which should not be that hard to do, I believe, and to give the example that the vaccine is safe and that it is not an experiment that the UN is, or the international community is trying to unleash on the African population. So you all know the misinformation that's out there. So I think it's really communication is the key. I just want to point out that there seem to be 2 chats here, and there's one chat in the Q&A that also still had 3 questions. I don't know if you still have time for that. But there is a chat.
We're running out of time. I would love to, I would love to hear David's view on the vaccine as well, and how to get it to the population quickly.
Well, I think Vivian makes a good point on the communication side. That can be a factor, even with the Ebola response. Well, there was a pretty good response to accepting the vaccine, about 90 to 95%. So I don't want to over-exaggerate that. But that 5% was also important because that allowed the virus to continue to propagate. But in general, we had that experience in the Beni area, and it was not a fundamental constraint, frankly. It depends on what the vaccine requires. The Ebola vaccine requires significant refrigeration and so forth. So it depends on that as well, on the logistics of it. But by and large, even a complicated one like the Ebola vaccine was successfully done in a conflict area where actually Ebola centers were being attacked. So I don't see that as a fundamental problem going forward. It will have to be adapted to the situation on the ground, depending on the nature of the conflict. But in Beni, it proved not to be a fundamental problem. It was a security problem, but not a fundamental one. Over.
Thank you. I'm going to give 30 minutes to each speaker to give their final thoughts. I'm going to start with Vivian.
30 seconds, I believe.
Yeah.
Not minutes. Okay. I would like to say mandates need to continue. If we don't, we lose our legitimacy. A few things that are really important is contingency planning. You can't start early enough for an all hazards environment. Leadership, I'm tying into the question from Milan that we didn't have time for. We need to really consider what kind of people do we put in the field, because if everything goes bad, which it is doing right now, you need a different type of leadership. So we need to really think about that. And then I would like to reiterate that integration is the key with all partners, including the government. And then a closing thought is, I elaborated quite a bit about the stress on staff. The colleagues in the field are cut off from their families and are cut off from the rest of the world with very few resources and no medical care. If they don't feel safe, this is tremendous stress that should be avoided in successive waves. And I would like to thank here WFP for having set up basically an airline that services Africa, because that was the only way for people that move around. So thank you to our partner WFP. I think the Secretariat needs to also make contingency plans for this to continue and to make sure that they are able to service the staff that is there in very difficult circumstances, serving the populations. Thank you.
Thanks, Vivian. Over to David for your last thoughts.
Well, maybe I work at different levels. Very briefly, as I mentioned, I think the unintended consequences of a response to an epidemic or a pandemic is extremely important to think through. You want surgical precision on the intervention so that it doesn't have unintended consequences, and I think that's true also with the COVID pandemic. Organizationally, I will just agree with what Vivian has to say. I think the ability to deliver is critical for our credibility, not only the legitimacy vis-a-vis the member states, but the population that we're here to serve. And that can be called into question as well. So, and then at the intermediate level between the more global and the broader UN institutions, the ability to react to this type of thing, I think there's a need for deep reflection after all this is over to see if institutionally we were prepared to deal with something of this magnitude. And I've seen this before where institutions are used to dealing with these kinds of issues, let's call it in the field, outside of the area of the headquarters. But when it comes to headquarters, not quite so ready to confront it. So I think it's important to relook at that deeply. Are we ready at all levels to deal with this so that we minimize disruptions to our operations, to people's lives? And I'll just finish with what Vivian said, and we need to treat our own personnel with the full respect of what they've done by staying here, what they have lost. I mean, I know so many people who've lost their loved ones while this has been going on and cannot go and see and grieve with their family, and they carry on, and they say, well, that's the way it is, and I will carry on. We need to be cognizant of that as well, and remember the human side of this to the people we serve, as well as the people that work for us here in the mission. Over to you.
Thank you, David. Over to you, Taufik, for your last thoughts.
Yeah, I think I would say that we're at a place where people are obviously under tremendous stress, both in the communities and in response, and we need to support them both. And I think there's been some great strides made in the last 6 months, but I don't think it's enough. I think what COVID shows is that we're wholly unprepared for global crises, wholly unprepared for global cooperation in regional crises. And we continue to stumble along, which is something that's been happening since Iraq, followed into the Arab awakening, into the conflicts that convulse with Syria, Libya, Yemen, Afghanistan that's been continuing. We're unable to solve situations anymore. I think we've had tremendous progress in some places. Some missions in the UN have made tremendous progress, I think, on the ground with some ceasefires. But I think overall, systemically, we have flaws, and those flow from our geopolitical environment globally. And I think we need heroes. I know it's trite and corny, but we need heroes to step up. And some of those heroes, they're not going to get platitudes for doing it. They're going to get shunted aside. And people need to be ready to confront those status quos and the powers that be. Otherwise, things don't change. And so we'll see if people step up. I'm waiting to see that.
Thank you, Taufik. This brings us to the end of the webinar. I want to thank the 3 panel members for their time and valuable insights on these complex issues. Special thanks to David and Vivian. We wish you the very best in responding to what's coming your way, and please stay safe. I'm also grateful to the audience for their questions. Thank you, everyone, and have a great day.